We have done a large research study looking at families with TTN-TV-related DCM, and we were particularly interested in looking at what factors are associated with disease onset. This is just a little bit of a schematic about the study design. So we had over 3,000 family members from around the world, across 12 different countries. And really what we were looking at were the odds of DCM within these families. And we looked at what factors might increase or reduce these odds and used that to look at what that might mean for clinical care for those patients. And that's really what we're going to talk about in the next couple of slides. So one of the main questions people often ask when they get diagnosed with a TTN-TV is, if they haven't already got dilated cardiomyopathy, is what is their risk of getting DCM, or what is their risk for other family members? And that's what we're looking at in these families here in these graphs. If we start by looking at this graph here on the left, what we're looking at is the percentage of people with TTN-TV that get dilated cardiomyopathy across age in years. And these are in our families. So we've got people with TTN-TV, which are in the yellow, and also family members without. And really what we can see is for those people with a TTN-TV, there's quite a sharp rise from about 30 years of age in their risk, or the number of people we saw in our families getting DCM. And this increases right up until almost 100% when people were hitting around about 80 or 90 years of age. And really what that's telling us is that if somebody with a TTN-TV lives long enough, then generally they will experience some kind of heart problems throughout their lifetime. And that may be earlier for some people, or it might be quite late in others. And that's really one of the questions we're trying to answer with our research. We can also see that for the family members without a TTN-TV, they weren't at zero risk. So they did develop DCM for other reasons, though this was at a much lower level. And then if we look just at those people with a TTN-TV, and we look at different decades of age over their lifetime, what we can see, similar to the graph, is this increases quite rapidly. And if we look at this 50 years of age one as a median endpoint, we can see that just over half of males at this point in time will have developed DCM, and just under 35% of females. So there's a difference in males and females in their risk for getting DCM. Females tend to be a little bit later than males by about 10 years. But overall, by the time they get to the 80s and 90s, the risk is quite high that they will have developed some kind of heart problems.